A new state bill proposes a more affordable route to prescription drugs.
23 News reporter Sydney Stoffregan talks to health leaders who say many people are being priced out of the market.
A survey of more than 1,000 people finds nearly 58% of adults in Illinois struggled to cover the cost of certain prescriptions in 2022. Sponsors say the Prescription Drug Affordability Act could ease that burden.
There are all kinds of people who can't afford their medications.
The U.S. Department of Health and Human Services says the average list price of prescription drugs nearly doubled in recent years. In Illinois, the Prescription Drug Affordability Act would establish a team to study how accessible certain drugs are to the general public. Senator Dave Kaler says the bill will set limits on supply chains and bring costs down for consumers.
Evaluate what's going on and try to bring the costs down so that people can actually afford the drugs that they need to take. This is not a matter of just choice, it's a matter of necessity.
Dr. Anthony Douglas, a resident at the University of Chicago Hospital, says many of his patients can't afford their medications and must choose to pay other expenses.
In marginalized minority communities who experience disproportionate rates of unemployment, the impact of uninsurance and the prevalence of chronic diseases increases dependency on pharmaceutical drugs, worsens financial burden, and leads to poor health outcomes.
Other studies show high prices force patients to ration their prescriptions and delay medication refills, which sponsors of the bill say is unacceptable.
The older you get, the more medication is really part of your healthcare plan. What happens is that seniors get really priced out of the market. It's not right in America where you would have people having to decide between paying the rent or having their medications paid for.
Senator Kaler previously showed support for the Illinois Generic Drug Pricing Fairness Act, which prohibited price gouging off certain medications. That act took effect earlier this year.
Thank you, Sydney. And with the filing of the Prescription Drug Affordability Act, Illinois will become the 9th state to develop a board dedicated to this purpose.